Good afternoon. We're here at the Pan American Health Organization with a Facebook Live event that details some of the important stories coming out of this Ministers of Health meeting that are discussing topics related to arboviral diseases and disasters. And to talk about these two things, we have with us two of the experts in the field. And I'd like to start with Dr. Silvana Aldeguieri, who has been leading the response to Zika, but is now, in addition to that, also looking at the overall plan that health authorities have agreed on measures to prevent and control mosquito-borne viruses in the Americas. And I'd like to ask Dr. Aldeguieri to explain to us how are we going to be able to control these mosquito-borne viruses in the Americas in an integrated way if we haven't been able to control any of them very well individually.
So you are already
I'm already giving you a tough question.
Identifying, yes, the complex issue and the complex situation. First, the Americas, the region of the Americas, and I'm talking about the intertropical region of the Americas, has been forever, for 5 centuries, prone to arboviral diseases, arthropod-borne viruses mainly. The yellow fever has shaped the movement of people, and I would say impacted in the colonization of this continent. So we are talking the very old diseases, but talking about the 20th century, and mostly the end of the 20th century, the dengue epidemic, or the dengue is even endemic to this region for years, has had permanent impact on the social networks and the economies of the country, of the intertropical region of this continent. We had still too many fatalities reported related to dengue, 7,000 fatalities during the last 14 years, and we had some bad surprises at the end of the 2000 with the re-emergence of the urban yellow fever. It means yellow fever not transmitted by sylvatic mosquitoes, but transmitted by urban mosquitoes and Aedes aegypti, which is unfortunately everywhere in this continent and all the subregions of this continent. So the sequence of chikungunya introduction starting 2013 and Zika introduction starting 2015 has clearly flagged the needs to have an integrated strategy. We cannot deal with these diseases by a silo approach. We need an integration of the surveillance. We need an integration of the clinical case management, because many of these diseases are very similar in terms of symptomatology. We need an integrated vector management strategy, which was developed years ago, but we need to plug it into the other components. And we need, very important, an integrated laboratory network able to detect and characterize viruses circulating in the same place at the same moment, and most important, new viruses introduced into this region. So it's why we can link the Zika emerging response to the development of this integrated strategy.
How far along are we in advancing on the laboratory side of things? How good are the diagnostic tests that we now have for Zika as well as for dengue and chikungunya, and can we integrate them at all? Or they're completely separate and expensive and difficult?
No, there is always a bridge between the sub-specialties. Where the region has advanced a lot during the last year, it's mainly the molecular diagnostic, famous PCR diagnostic. We know how to do PCR for dengue, we know how to do PCR for yellow fever, PCR for chick, PCR for Zika. Where now we have still challenges is the serology. For the serology will help you to do a retrospective diagnostic. What happened to the patients a couple of days or weeks ago, when the PCR will detect the acute phase of the disease. And unfortunately, the new Zika emerging virus is from the same family as dengue, yellow fever, and West Nile, which were already circulating in this region for years. And we have cross reactions, cross reactivity between the viruses of the same family. So this is one issue. The serology is still the main challenge. And on the other side, also we have some viruses as the Mayarovirus, which are part of another family called the Alpha virus family, which is very close to the chikungunya. So we have also challenges in terms of serology. So we are permanently fighting with a good platform dealing with molecular diagnostic for acute disease and challenges for establishing the difference between these viruses according to the serology.
So let me make a transition from the challenges that we face with virology and serology to the challenges that some of the countries may face in disaster risk reduction. And with us we have today Dr. Alex Camacho from the newly formed Public Health Emergency Program. And Dr. Camacho, can you tell us a little bit about what the countries are doing to advance the concept and the practice of disaster risk reduction and what they've discussed a bit at this meeting?
Yes, good afternoon. As you said, the countries have a great challenge to reduce the risk related to disasters and also to emergencies. The Americas, as we know, is the second affected by disasters after Asia. The Americas, all the disasters that happened in the last 10 years happened in the Americas, with more than 250,000 deaths, a lot of disabilities, persons with disabilities, and of course with millions of dollars in affection. So the Pan American Health Organization has been working with member states, strengthening the capacities to respond timely in a good manner to disasters. In the last 5 years, many disasters have happened in the region, and the Pan American Health Organization has been working with the member states hand to hand with them. Mm-hmm. Now we are implementing several initiatives as smart and safe hospitals. We're strengthening the governance as well, and of course the emergency medical teams. That's a new initiative that we are working, and that was tested in the last heatquake that happened in Ecuador. Being Ecuador as the first country in the region to implement, the norms and all the procedures related to emergency medical teams. So, in this meeting, the member states are discussing the plan of action for disaster risk reduction. It's a plan that is the result from the discussion from the lessons learned in the plan of action of safe hospitals, and also the priorities that the countries have identified in several discussions in the last 12 months. It's a year that we are discussing that. So this plan is aligned to the Sendai framework that was discussed last year in Sendai. That's why this plan has 4 lines of action related. The first one is related to recognizing the risk. The second one related to governance, also to strengthen the initiative of smart and safe hospital. And third, and the fourth one is focused on the response, strengthening the response in the early recovery of the member states. So for each one of these, we have several objectives that are linked to these international documents that we were discussing, Central Framework, 2013 agenda and 2030 agenda, and so on.
Oh, very interesting. I know that the Disaster Preparedness Program celebrated its 40th anniversary, and I know it was one of the leaders in the world in terms of preparing countries to confront and respond to disasters. Apart from the basic tenet that a health system, a health facility can only function and keep functioning in a disaster if it's still standing, or if it still has water, if it still has electricity and still has emergency, what are the other really major facets for the health system of disaster risk reduction? What else do local health systems, ministries, and even clinics in the field have to do to be prepared?
As you say, the best hospital is the one that keeps staying after a disaster. So one of the things is, of course, not when we are talking about safe hospitals or not smart hospitals. We're not talking just about infrastructure. We're talking also to the preparedness of the main procedures and the strengthening of the main procedures inside of the healthcare facilities. We're talking about preparedness. We're talking about the need to strengthen those plans and also to test those plans before something happens. So there's a component inside this initiative called Safe Hospitals that's focused to prepare the healthcare workers to respond in a good manner in case of disasters. Mm-hmm. We had a really nice experience in the last disaster in Ecuador. The province of Manabí, we knew already what hospitals were going to be affected if something happened there. Mm-hmm. So that personnel was properly trained, so they responded in a good manner after the earthquake. No one died, and what is most important, they continue operating after the earthquake, and that's why Ecuador had a very good response after the earthquake.
Okay, let me ask Dr. Alighieri about the role of local health centers, hospitals, clinics in the response to arboviral disease. Usually it's the health post in a rural area or in an urban slum that a person who has a fever and a rash might go to and present to the health authorities there. Are we doing much more to prepare some of these local clinics and kind of country doctors to be able to either diagnose or refer on people with febrile illness that might be due to one of these arboviral diseases?
You are making an excellent point, Dan. You are bridging the emergency response concept and aspect to the need for having resilient health systems.
That's what I was trying to do.
Exactly. It's a good point, and I will use the personal bias since I'm in charge to coordinate the efforts of PAPO for the Zika emergency. So I will use the example of Zika. It's only through resilient health systems that we would be better prepared for the next shock. And the example of Zika, which is a virus known for 70 years, transmitted by a mosquito, we were caught by surprise by the emergence of microcephaly and all the malformations. Ready. Never happened before. Or it was never detected, but we think it never happened before. And now we have this virus, sexually transmitted. So we are activating different parts of the health system, from primary health care with the detection and I would say the ability to do the difference between different viruses. Dengue. Zika is basically, most of the cases are like mild dengue, similar to mild dengue. So we need health providers at primary health care able to do the difference between dengue and something different. And also chikungunya, because in addition chikungunya has a long-term impact on the patients. And also you need technical platform to support the Zika response. pregnant women potentially infected or infected by Zika during their pregnancy need access to technology. They need access to radiology, to ecography, to laboratory platform. And after you also activate another sector, you have the perinatal care, the postnatal care. These children with microcephaly will require rehabilitation, physiotherapy, stimulation, here high assessment, and the long-term follow-up, including the family follow-up, including how the bridge between the healthcare, primary healthcare, and the family care. So resilient health systems are necessary to be better prepared for the new shock, the new emergency. And it will come. Unfortunately, during the last years in the Americas, 2009, the flu pandemic, 2010, the cholera in Hispaniola and other countries, 2013, the chikungunya in the Caribbean, now in all the continent, in intertropical areas, obviously. The preparedness for Ebola, with a cluster of cases in North America at the end of 2014. And now the Zika. So resilience of health systems is really the way to go for the countries, for the governments, and for the ministries of health.
So what does it really mean to have a resilient health system? Does it mean being prepared for any contingency or any emergency?
Being
or
prepared,
able to respond, or what?
being prepared, able to respond, better response, adapt to the situation, but also to continue giving attention.
It's all the cycle.
It's all the cycle,
Including
cycle,
recovery.
including recovery as well. So one of the key elements in resilience is also the assessment of the last crisis, or the last emergencies, last disasters, and how in the next emergency, in the next crisis, we will use that evidence to better reconstruct, better respond, better recovery, and so on. A key element in resilience is the community, and we are talking about our member states, the community, health workers, and all of those that are working together with them really are at the base of this process called resilient health systems, as Sylvain said.
Okay, I think that covers what we needed to talk about today, and I think the focus on the community and how the community is both affected by new diseases like Zika, disasters or earthquakes that may have happened, and how it responds, I think will be one of the more interesting ways to look at resilient health systems, and arboviral diseases, disasters, and some of the things that the health systems of the Americas are confronting, and some of the things that the health ministers from the Americas are discussing at this 55th Directing Council meeting. So we want to say thank you for watching. If you have questions, forward them. We will pass them on, and we will come back tomorrow with another session on something equally interesting. Thank you, Dr. Camacho and Dr. Arboviral.
Thank you, Dan.